Okay, so the average person that goes to the doctor, or average times is 4 times in the United States, while in Germany it's 9 times. So I think that's crazy to think about, that we spend so much money on healthcare, but like the people here aren't trying to go to the doctors.
So one thing about that is, say in Germany or in anywhere in Europe or Russia or anywhere, the reason they might be visiting that so many times and they can and it doesn't cost as much is possibly some people don't have in consideration that their medicine, they probably don't receive the care that they are desiring to care so they keep having to keep going back for visits and visits and visits on top of visits. But our care and our medicine and our pharmaceuticals may be expensive, but an average American will go to the doctor whenever they need to go, and they get what they need to do, and then if it doesn't work, they go back. But yeah, it just has a lot to do with who has what and who's better at what. And so if I were to go to Europe and they don't have the best care, and I come here and it's like, wow, and it's going to cost me a little bit more, but if it's worth it, then it's worth it. So
That's true.
Japan as a country invests tons of its federal spending into its healthcare policy, and in Japan, the state-run healthcare is regulated at such an extent. They go over it every year to make sure everything is spending. Every single medication has a proper cost, and it makes costs incredibly low. An overnight stay in a hospital is only about $60, while in America it can be hundreds of dollars.
yeah.
And the result of this is that a doctor, for like a 6 centimeter cut, which is about 3 inches or so, that's $4 for the doctor. Every 6 centimeter cut that's stitched back together is $4 that goes towards the doctor.
Yeah.
So if he's being paid $4 to stitch up this thing in your arm, he's not going to really, that's not really of care as much if you were being paid like $20 for that or more, which is in the U.S.
Yeah.
In the United States, it can cost like 50 or upwards, even $100 to get that stitched up if it's on your head or somewhere more difficult to go. And the doctors are going to be careful with that. But I think we need to regulate that, but not so much that it plummets the quality of care down.
I agree. So you're saying basically if I get a patient and it's going to be an easy fix, but I'm only going to get $4 for it, so I'm just going to guide my way through it.
So
I
you
see
feel
what
like
you're
that should be like regulated more?
Yeah, it should be, because in the United States it costs a ton of money, which is going to ensure the quality of care. Because if you mess something up, then you're going to get sued.
Yeah, you're
going to get
sue, and yeah, that's correct. But
So-
in other places, those doctors aren't making very much, so it doesn't. They don't really care, and that's one thing about the great thing about the U.S. is that our doctors, people come from all around the world just to get like neurosurgeons in America. They need to get a hold of them because in other countries such as Russia or Germany or anywhere, they're probably not up to expertise as somebody like Ben Carson is. So it's all about the care. But one thing about the care is, you want to start a new topic, or do you have any facts?
I don't think I have anything.
Well, the major question that we had this unit was, does a person have a right to health care in the United States, or is it a privilege? So
I honestly think that, like, looking at it from like a different side, and not just thinking that, oh, like everyone deserves healthcare. We have to think about like how much money that the people are spending for the people that like aren't working, that aren't paying taxes.
Gotcha. So as being a child of a middle-class working Americans, we understand that tax dollars are very high when it comes to that type of stuff. Like, and recently they've been going down because of different reasons. But if I'm going to go to work every day and try to make health insurance for my family nice, and I can make sure that they have everything they need, while on top of there's people over there that if you wanted to sit on the couch and not go to work, you could apply for Medicare and you wouldn't have to work, you wouldn't have to do anything, those people would pay it for you. But you could go to these doctor's appointments on their dollars. So that's the deal with that. So it's just different ways you think of it, and if they really need that care, that's my thing though. If they really need that care, and if they really need assistance, they can get it. I believe that should be their American right. But if